Yeah.
All right. Thank you very much.
And that's just real quick. I could, you know, I would definitely, with him, he's had it for so long, I guarantee you up in his hip, his lower back, I would address too. And then I would even work on his feet. And eventually.
Excellent. So we've looked at that hand carpal tunnel area.
Elbow.
We've looked at the elbow. We've looked at the plantar fasciitis area,
the knee,
the calves, and the knee.
Lower back,
shoulder issues. Randy,
anybody else?
You have some issues on that shoulder.
Yeah, rotator cuff.
Tears, or just impingement. What do you have?
Abuse.
Abuse.
Yeah.
Okay, so you probably got a little small tears or something. Let's just take a look. See what. Is there something that you know you can't do that I could work on to see if you can do it?
Well, I don't have my flexibility is here.
Okay, so you range of motion.
Pain.
Okay.
I can go higher, but that's
okay.
where the pain comes.
All right, let's see if I can increase that range a little bit. How long have you had it?
Years.
Okay.
Yeah.
Yeah. See, again, most of us just live with this stuff, you know, and that's where it doesn't need to be that way. I mean, some of these things we can take care of, and why live in pain if we can take care of it?
Yeah, I've never really. The only advice I've ever gotten was to do some specific exercises to strengthen the muscles around the area.
Right, and that's again, a lot of my patients come to see me. But if you don't treat the cause, then you're just going to treat symptoms, and it's going to come back. So we got to find out, you know, what happened, and we're gonna treat your shoulder right now. Lay on your back for me.
This way?
Yeah, head up this way for me.
So Scott, when you were talking about the blood flow and good blood and bad blood and so forth, you know, you've been treating me for 7, 10 years, and being a golfer from shoulders to heel to actually turf toe. While you're working on his shoulder, I noticed that after you worked on me, that sometimes I'm thirsty. I need to drink water. Is this important after you start doing your own application, the hydration part of your body and your muscles and so forth?
Correct. You want to make sure you're always drinking at least eight glasses of water a day anyways, but the more you do this, the more liquid you take, the more you're going to help flush that system out. So yeah, just straight water is fine. You know, try to stay away from carbonated liquids, especially coffee and teas. You know, they're going to be more of a diuretic. So yeah, drinking some fluid right after this is a great idea, and throughout the whole day. Yeah.
So that will help the blood flow, and that will help heal the areas where you're
correct.
going.
It will help your body become more alkaline and not more acidic. A lot of these problems that are chronic, it's because the body's real acidic in that area. Again, waste products just sitting there like a static pond. Just, you know, that green scum that's on that pond. That's what's going on in these areas. We need to get that stuff out of there, again, to let the body heal itself.
So the tool in your cream is starting to break up the toxins.
Well, it moves the toxins around to get them out of there. So it breaks the toxins in the scar tissue. At the same time, it flushes the stuff away back into your, kidneys and liver to filtrate it.
That's opening up that freeway concept
correct,
again.
That freeway that you were talking about.
So like what Jim shared about his family, with all the different activities from the different ages and so forth, if you don't even have problems, just muscles and daily use and reducing the toxins, is this cream good just to use as a massage on an everyday product and help reduce your toxins?
Sure.
Just by
well, you can do that. Sure.
And Randy, what are you feeling now?
Actually, a little bit of relief. I can definitely some deep areas there that it's bringing out a little of the pain.
Yeah, you feel it right in here, huh?
Yeah.
Yeah. And a lot of times we'll find that bicep, that long head of the biceps gets really scarred down, and his is pretty scarred. So I'm just going to work in this.
Scott, what percentage of the patients that you see have issues with the rotator cuff area, the shoulder area?
25% of my clients. And probably of those 25%, 80% of them get relief with the PMT technique. And then of course you have to exercise and things like that, but that's just the start. And so I think eventually we're going to be giving some exercises for this technique also, I believe, correct?
Yes, absolutely, absolutely. So if Randy undergoes this treatment, let's say his son treats him, learns to treat him with the Rehab1000 and the PMT, is it a couple weeks, a month? How long before Randy sees relief from the chronic pain and better range of motion?
He'll feel it right today. But, he'll see probably about a 25% increase in range of motion, probably a 20 to 50% decrease in pain in the first treatment, and it's just going to build from that. Now, if it doesn't get better in the first 3 or 4 visits or treatments, then you got to see a doctor. You know, and then you may have a tear, complete tear, or something like that. I mean, this is a tool not to treat everything, it's just to help musculoskeletal problems and help evaluate whether, you know, I'm not saying that, you know, we don't need to go see the doctor, but a lot of our issues can be treated before they get to that.
Absolutely, absolutely. At Longevity, we're so excited about the potential for Rehab 1000, for people sharing the Rehab 1000 cream and the PMT and the Pennsylvania method technique with their friends and their family members, because what a better way, you know, I mean every friend that I have, every family member that I have doesn't want to see me in pain. So if they know of something like this, you know, they can help me get out of that chronic pain, those issues, and get me into preventative areas so that I'm I'm healthy.
Yeah.
Do it again.
Yeah.
Yeah, good. And you can see he's got some redness. The alopecia started, and that's because, again, it's chronic. And you know, I've had a little more time. I'd work on this back in here, and then eventually give him some exercises, because now that the muscle's in a better environment, now we want to make sure that we stabilize that area by giving it good exercises to do.
Is there any connection with the shoulder and that neck area as well?
Yeah, neck. I very rarely treat just the shoulder. That's why I said I'd work on his. I got time. I mean, work on his neck. You got time?
Sure, absolutely.
Right. Lay on your stomach, head up that way. Lay right on your stomach, head in that hole there.
I think too, an interesting thing is the recovery time. So for these really elite athletes that are training really hard all the time, like Evan Song and is such a competitive tennis player, how much does this improve your recovery time to get you back out there so you're able to work even that much harder?
Today's world, it's so competitive out there that everybody wants an edge. Everybody, whether it's, you know, nutrition, whether it's the way to work out. This is one of the ways that I think we can get people back on the court, back in the field much quicker than any other treatment right now. So
Evan, maybe you can answer that question for Katie. What have you felt? What have you experienced with Rehab 1000?
Whatever can help me, you know, beat my opponents, and this really seems to be what's helping me.
You've come in with shoulder injuries,
Yeah, I've had shoulder injuries,
and with the tournament coming up, and you've walked out of here. Correct me if I'm wrong.
It works instantly. It's really phenomenal when it does. And with the rehab cream, the rehab cream sometimes, you know, it'll last a day or two, you know, before you have to reapply it. So it's really.
So you'll feel that heat, that warmth for a couple days.
Yeah, I'll put it on the night before, and I'll feel it the next night, and even the day after. So it's really incredible.
Awesome, awesome. Wow, that shoulder is bright red, Scott.
Yeah. Okay, let's have you sit up again. And that's the combination of the Rehab 1000 combined with the PMT. Can you feel even better?
Yeah.
How's that feel?
I feel good. Even when you put my arm behind my back, it wasn't painful.
Used to be like, oh,
Yeah.
like putting a belt on or something like that.
Yeah.
Yep. And I think if we did this probably 6 times with some exercises, his pain would be probably 80–90% better.
Awesome. Joe, you are in the medical industry. You work with doctors every day. And when I was explaining a little bit about this, you talked to me, you know, is it like BioFreeze? Is it like Tiger Balm you mentioned? You know, maybe Scott, you could address that. I mean, I have never seen a product like Rehab 1000 and the PMT application method. You know, is this better than BioFreeze? Is it better than these other things in the marketplace?
In my practice, I've used BioFreeze. I've used all types of ointments, and they have helped a lot of my athletes, but not to the extent that this has. The reason why, it's a combination of a method and a cream together, where those are more counter-irritants when you feel the heat or the cold. This actually, with the technique, actually breaks up the scar physically, where the creams don't do that. Except for the Rehab 1000 combined with the PMT, you're going to break that up and get I think the performance that I'm looking for. Not just to feel the heat, but actually doing something more at the cellular level. That's right.
And also help the patients rebound faster from maybe a total joint replacement, maybe a hip or a knee or a shoulder replacement. When they use a product like this, you know, there's an extensive physical therapy rehab process that can be diminishingly reduced.
Correct. And with today's and with today's insurance, we're seeing less and less insurance companies allowing us to see patients at a length of time. When I first started 25 years ago, you got a patient, you could treat them until they're ready to go. Now, they have to be out of here in 6 to 8 visits because the insurance company's cutting them off. So I have to have, and that's why I came up with this, I had to find something that was going to not only help the patient, because I felt guilty letting these people go with nothing, and they didn't reach their full potential because their insurance stopped paying. Now what I have is an opportunity to have them treat themselves, know that they can always fall back on something to help them get better over time. And it's quicker, faster. Most of the time I would take, somebody, for instance, with the shoulder, it'd take me 6 to 8 weeks to get somebody better. Now I'm getting people better 6 to 8 visits, getting them off on their own program and saving them money, saving them time. Having a patient come here 3 times a week for 6 to 8 weeks, that's a lot of time, a lot of money that they lose. And I'm trying to help prevent that loss in income, get them better faster, quicker, and at the same time promote good health care.
Scott, on behalf of the Longevity Family, we're so excited about our association, our relationship with you. We want to bring so many of our people in to get trained not only in basic training 101, but intermediate training 201, and the advanced training 301. So on behalf of the Longevity Family, thanks for being in partnership with us, and we're really excited. Let's get out there and help a lot of people.
Okay, let's do it.
Okay.
All right. Good, thanks.